Hello everyone, welcome back to my YouTube channel. Today we are going to talk about anatomical planes. We will start our topic with introduction. Study of anatomy involves understanding the spatial relationship of body structures. Anatomical planes are imaginary lines used to divide the body into sections, providing a standardized method for analyzing and describing locations, movements and orientation of different parts of body. These planes are crucial for medical professionals, researchers, and students of anatomy. Now let's talk about the types of anatomical planes. There are three primary anatomical planes. The first one is sagittal plane, the second is transverse plane, and the third is coronal plane. And now we'll talk about them one by one. First plane we have is sagittal plane. We can define sagittal plane as sagittal plane is a vertical plane that divides the body into left and right halves. Its types include mid-sagittal plane, that is also called as median plane, and parasagittal plane. Mid-sagittal planes divide the body into equal left and right halves, while parasagittal planes divide the body into unequal left and right halves. Examples include movements like forward bending and backward extension occur along these planes. And the brain has a mid-sagittal section that separates the right and left cerebral hemisphere. Moving towards the next plane, that is frontal plane, or it is also called as coronal plane. It is when the frontal plane divides the body into front and back portion, or into interior and posterior portion. Example of it include movements such as side-to-side arm lifts. Abduction and adductions occur in this plane. A coronal MRI scan can give a view of full body from front to back. Now moving toward the next plane, that is transverse plane. We can define it as transverse planes divide the body into upper and lower sections, or divide the body into superior and inferior sections. Its examples include rotational movements such as twisting the torso occurs in this plane. A transverse section of the brain helps in viewing the cerebrum from above. Now let's talk about the applications of these anatomical plane. First application is in medical imaging. MRI, CT scan, and X-ray use anatomical planes to interpret images. And the second application is in surgical procedures, as surgeons plan incision and intervention based on anatomical planes. And third application is in physical therapy and movement analysis, as it helps in designing rehabilitation exercises and understanding body mechanics. Now talking about the conclusion. Anatomical planes provide a structural approach to studying body orientation and movements, and they are fundamental in medical education, diagnostics, and patient care. So this was all about the anatomical planes. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.